Aneurysms run in Jane Weiner's family. Her brother survived a brain aneurysm. Her grandfather did not. When Jane's mother was diagnosed with an abdominal aortic aneurysm, her surgeon told Jane and her sister it was time for them to get checked.
I just happened to go and get an ultrasound and found that I did have the beginning of AAA.
AAA, or abdominal aortic aneurysm, is the enlargement of the aortic artery, the largest artery in the body. The condition is most common in men over age 65, especially those who have smoked. But as in Jane's case, it can affect women and can run in the family.
And what happens in an aneurysm is that the wall of the artery becomes weakened, and as a result, because of the continued and relentless pressure pulsing against the wall on the inside from the heart beating, the diameter of the artery changes.
Despite the changes or bulging of the artery, AAA does not show any symptoms, making it extremely difficult to detect. Jane never felt a thing.
Nothing. Absolutely nothing I would not have known.
A ruptured aneurysm can result in severe hemorrhaging and sudden death. But when detected, abdominal aortic aneurysms can be successfully treated. At the Cardiovascular Institute at Beth Israel Deaconess Medical Center, some of the best vascular surgeons in the world perform the two most common treatments for AAA: open surgical repair and endovascular aneurysm repair. With open surgical repair, surgeons clamp and remove the portion of the aorta with the aneurysm, then replace it with an artificial graft made from Dacron. The procedure is major surgery.
The average hospital length of stay runs into 8 to 10 days, of which usually the first day or two might be in an intensive care unit. And the time to full recovery can take 3 to 6 months.
Jane opted for a newer, much less invasive treatment: endovascular aneurysm repair. Surgeons make small incisions in the groin and insert tiny Dacron-covered wire mesh metal tubes called stent grafts. The grafts allow the blood to flow around the aneurysm and through the graft instead, eliminating the possibility of a rupture.
Think of it as a new lining in the pipe. So instead of actually replacing the pipe, you'd place a new lining within the pipe.
Because the procedure is less invasive, hospital stay and recovery time are much shorter.
The operation usually takes about 2 hours. Most patients will go home either the next day or the day after that, and complete recovery usually takes less than a month.
3 weeks later, we had a snowstorm and I was out shoveling snow. So as you can see, the recovery time is very, very short.
Like most patients who undergo endovascular aneurysm repair, Jane must have an annual CT scan to ensure that the stent remains in the proper position.
Now more than a year since her treatment, and she looks great and is doing very well.
Endovascular aneurysm repair results in fewer complications and reduces the mortality rate in patients from about 10% down to only 1 or 2%. It is especially beneficial for elderly patients who may not be healthy enough to handle major surgery. Whatever AAA procedure you and your doctor decide on, the team of cardiologists, vascular surgeons, nurses, and medical assistants at BIDMC's Cardiovascular Institute will ensure you get the best care possible.
It's a wonderful hospital, and I really would recommend it to anyone.